all about like when I was a rep,
Right.
I was looking after one territory, and as the area manager, I was given a bigger territory. So again, a challenge because you don't know the another territory, so you have to know the territory. Again, when you grow up, you are now looking after a state. Again, you grow, you are looking after a zone. Similarly, when you go move from one country to another country, the first thing is you should know the what is the market of that. Like Indian market is today 2 lakh crores, more than that.
One decision can make them successful, and your one decision can vanish this whole company. So how do you see this whole responsibility?
My one decision can bring the company down.
Right.
My one decision can take the company to thousands.
Right.
As I said, the first thing is to know the pull and sell yours and give them that confidence that you are the people who have brought it 300 crore. So you will only take it to 1000. Nobody else will come.
Welcome on the show, sir.
Thank you.
Sir, just tell us about your journey, sir.
Yeah, I'm Rahul Shankar, and after doing my graduation from Lucknow Christian College, I belong to UP.
Okay.
A place called Sitapur, which is approximately 80 kilometers from Lucknow.
Okay.
And I graduated from Lucknow Christian College. And then I was looking for some job. And one day I found, at that time, this online everything was not there. So newspapers were having the vacancy. So I saw a vacancy, I went, I gave interview and not selected.
Okay.
This happened for 3, 4, 5 companies, and finally I got selected in Dr. Reddy's Labs.
Okay.
That time it was not called Dr. Reddy's Labs, it was called Stangen and Genesis.
Okay.
So I was selected for Genesis. Later on they merged. So I worked there for 6 months and I found a good vacancy in EMARC, which was a multinational, German multinational. So I shifted to Merck and worked there for 10 years. Initially the medical representative, then the area manager. Then I shifted to Wallace, where in UP I have launched the rheumatology and diabetology division of Wallace for the first time. Later on I joined Universal Medicare. And I launched the specialty division of Universal Medicare in the entire North. And products like, for the first time in Indian market, we have launched a product called Colaflex, which was a collagen brand for the first time in the Indian market. Then Universal was acquired by Sanofi, and we all went to Sanofi. And there I shifted from sales to training. So in Sanofi, I shifted to training. And then our MD got retired and he wanted to open his own organization. So he asked me to join his organization. I came from Delhi to Mumbai now and joined Innovcare Life Sciences in 2014 and worked there for 8 years almost and worked for in the entire country in Innovcare. Later on, I got an opportunity to launch a new business again, Make Money Life Sciences.
Okay.
So Make Money Group actually is a 10,000 crore group in India.
Okay.
They are number one in dyes, chemicals, APIs, but they were not in formulation business.
Okay.
So I got the opportunity to launch their entire formulation business in entire India as a general manager. And then I got this opportunity of working with Nepal Pharma, Arya Pharma in Nepal as a CEO. So I joined just 6 months back as a CEO of Arya Pharma. So that is my journey of 30 years.
This is commendable, sir. मतलब start as a medical representative, right? And then उसके बाद में right, you now working as a CEO, right? It's a like huge thing for generation like me. But सर मतलब इंडियन मार्केट में बहुत सारा जितना मैंने देखा है लाइक लोगों के साथ में लोगों की स्टोरीज सुन के कि बहुत सारे लोग इंडियन मार्केट से स्टार्ट करते हैं और फिर डिफरेंट मार्केट में एंटर करते हैं. जैसे इंडिया फार्मा के बहुत सारे लोग हैं जो लाइक साउथ अफ्रीका मार्केट के अंदर उन्होंने एंटर किया, राइट? कुछ लोग हैं जो अलग कंट्रीज के अंदर जाते हैं. नाउ यू एंटर्ड इनटू द नेपाल. तो कौन कौन से चैलेंजेस आते हैं सर मोस्टली?
Whenever it is all about like when I was a rep,
राइट.
I was looking after one territory. And as the area manager, I was given a bigger territory.
Right.
So again, a challenge because you don't know the another territory.
Right.
So you have to know the territory. Again, when you grow up, you are now looking after a state. Again, you grow, you are looking after a zone. Similarly, when you move from one country to another country, the first thing is you should know what is the market of that. Like Indian market is today 2 lakh crores, more than that.
Right.
Like only Nepal market is only 7,000 crore, a small market. So I feel that just like India was at that time 30 years back when I was there
Right.
as a rep, the market is like same today in Nepal. So it has
Okay.
to grow.
Okay.
Second thing is the practices like in when I was a rep, like smaller doctors were having lot good practice. Not there were not big shots like in India also. No big cardiologists or very big cardiologists are very less. Endocrinologists very few. In fact, endocrinology उस समय ब्रांच ही नहीं होता था,
Right.
है
Right.
ना. नेपाल में भी वही आज है कि आज वहाँ पे मीडियोकर डॉक्टर्स का प्रैक्टिस ज्यादा है, बड़े डॉक्टर्स उतने नहीं है.
Right.
एक चीज बहुत अच्छी है, 90% ऑफ डॉक्टर्स जो है इंडिया से पढ़ के गए हुए हैं,
Great.
तो दे नो इंडिया
Right.
एंड दे नो व्हाट हाउ द इंडियन मार्केट इज देयर. तो पहली चीज है कि जब भी आप किसी नई चीज को हैंडल करते हैं, यू शुड नो द मार्केट.
Right.
दूसरी चीज है यू शुड नो द पीपल,
Right.
क्योंकि इस मार्केट में काम तो पीपल करेंगे.
Right.
एंड ये बहुत से लोग ऐसा करते हैं कि
Right.
वो गए किसी कंपनी में तो पहला काम करते हैं, पहले पुरानी पीपल को सबको हटाना शुरू करते
Right.
हैं. बट आई बिलीव पीपल इज द मोस्ट इंपॉर्टेंट स्ट्रेंथ.
Right.
आज अगर आर्या फार्मा लैब इज a 300 crore company, this is because of people who were there.
Right.
Now I have a challenge to take it from 3,000 to 300 crore to 1,000 crore. That is my job. That is not. So I don't want to remove people. So the second thing is people. And as a CEO now, my vision has to be that these people skill set has to improve.
Right.
So once you have known the market, second thing is you have taken people into confidence, things automatically become easier.
Right.
And once things are easier, once you know the market, once you know the people, then you have to present your vision as a CEO. What is your role? You have to present your vision to the team.
Right.
You have to sell your vision to the team.
Right.
If team is on that vision, like if my vision is that today Arya Pharma may be number 5 in the Nepal market, tomorrow it has to be number 1.
Right.
Then entire team's vision has to be that
Same.
yes, Arya Pharma has to be number 1 company of Nepal. So that is our first vision. As I said, we are working how we are going to into exports. That will be a separate business. Maybe tomorrow we are going to launch in Indian and Bhutan and other markets also. That is also we are leveraging. So lot of things are being done when it comes to improving the not only with the visibility but taking Arya Pharma global. So today our vision is that it should be number 1 company of Nepal, but at the same time it should be a global company, and maybe in 10 to 15 years time it may be a number 1 company in various other like maybe Africa or maybe even in India. In India, Sun Pharma and Mankind has taken 30 years to reach to around number 1 position.
Hmm.
So why can't we, in this age, can take only 15 to 20 years?
Right.
Yeah, that can be the vision, and only with the right vision we can succeed.
I can see this in your eyes, that whatever you are saying, like it has some meaning to it, right, and some vision you have. But sir, the only question now, right, that this position, right, CU comes with a lot of responsibility, right? Every single employee see you as a leader and depending on you, right? Your one decision can make them successful, right? And your one decision can vanish this whole company, right? So how do you see this whole responsibility?
You're right. My one decision can bring the company down.
Right.
My one decision can take the company to 1,000 crores.
Right.
As I said, the first thing is to know the people and sell your vision to them.
Right.
Give them that confidence that you are the people who have brought it to the 300 crore, so you will only take it to 1,000 crore. Nobody else will come. Maybe Mr. Rahul Shankar will retire after 7-8 years. Somebody else from you only will be the CEO. Na?
Right.
So that vision has to be sold to the team. That confidence has to be given to the team. Because, as I said, just like 30 years back, India was there, Nepal market is like this.
Right.
So we have to give them skilling.
Hmm.
That is why we called Mr. Yashwant and we have skilled them.
Hmm.
We have to give them the plans, the strategy by which we are going to be number one in Nepal.
Right.
And not only, it is not about that I have told you some strategy and you have to do it.
Right.
It is about convincing them that yes, only with this strategy we are going to develop. And in the last 6 months' time, we have grown only because of, we could have degrown also, but we have not. We have grown only because of one thing, that the entire team is aligned today that yes, this strategy is right, and because of this strategy, we will be number one company. Every employee feels something that yes, I am working in number one company. Today, such pharma employee can say in India, yes, I am working in number one company. When I was in Merck, that time Indian market was totally dominated by Glaxo, Merck, Pfizer, Boots, these multinational companies. So we were used to say with proud that I am working with Merck. Today, a Arya Pharma employee in Nepal has to say, yes, I am working with Arya Pharma, and because of me, Arya Pharma is number one company. So that is my journey of 30 years.